Hello to my dearest students out there. Warm welcome to the next step towards the final destination. Is my voice audible and clear to all of you out there? Hello, Maria. Hi, Pagalu. Hello, Anusha. Hi, Sharika. I hope you all are doing fine. Hello, Nisha. Thank you very much. The voice is audible and clear. Hello, Anu. Thank you very much. Hi, Mufida. Hai, Janani. Thank you, Sharika. Lovely seeing you all here. Thank you very much. So Know Your Exam series, Mrcog 3. Let's see what it is all about. Warm welcome from the entire team of RFA tutors. It is a lovely feeling to see all my students again, taking a step forward, a shift over journey from the single best answers and extended match questions to talking to the examiner and communicating with the role player. This transformation of preparation journey, we call it as Mrcog Part 3. Inspire yourself to take the one last step. You're very close to the victory, friends. Thank you very much. It has been long. I know you people have been missing me for this. Thank you very much, Sabarnika. Thank you very much, my dear. I'm grateful, Pallavi. Likewise, lovely seeing all these names together again in the chat box. Thank you very much. All right, so what are we going to discuss today? We are going to discuss that what is the exam format, what is this shift over, and how to prepare for Mrcog Part 3. What are these things which actually help you, and what is going to be those things for which you are going to take care of the booking guidance, when to take the exam, when are you ready for this, why do students fail in this when their approach is not fine, and how to make it in one go. All these points we are going to take care of. Now, I would just like to emphasize on this point that students had been working hard. I've seen and observed hardworking and focused students learning speedily. The earlier you understand the gist of the exam, the better it is for the smooth flow and a fluent speech, because it's all about speaking. As I said earlier, it's a shift over from the written exam, from your single best answers and extended match questions, the same applied clinical knowledge we are going to use on speaking and communicating. So if you understand the exam from day one and you're in the right direction, it's a matter of just 2 months as the applied clinical knowledge is fresh for all of you out there. I would like to tell you that how the exam is conducted, what are the basics of the exam, what you all should know about the exam, and you people would see the difference at the end of the session. You people would be pretty clear about how we have to manage this Mrcog Part 3 journey and how to make it in one go. The first thing you need to understand is the exam format. What is that? Thank you very much, Maria, my dear. Thank you, Aisha. Thank you, Lolwa. Walaikum assalam from my side as well. Good evening to all of you out there. It is a circuit. When we say circuit, these are 14 stations. Now, 2 minutes reading and 10 minutes is the actual time where you present the station. I repeat that once again. 2 minutes would be the reading time of the candidate instruction, and 10 minutes would be the actual time of presentation in front of the examiner. This presentation time would be 10 minutes. After these 10 minutes are over, again, you will have your 2 minutes and then 10 minutes. 2 minutes and 10 minutes. That makes a total of 14 stations, 168 minutes of exam. Clear, everyone? Anam, are you there? Yes, my dear Arti, you asked this question a few days back. 168 minutes of exam, 2 minutes of reading, and 10 minutes of the presentation, please, right? Now, in the OSCE generally, when we used to take the exam, it was an on-site exam, so no preparatory station or no break is in between, right? Each station, Lolwa, is 12 minutes, in which 2 minutes is your reading time and 10 minutes is your presentation time. Okay, so 2 minutes you read the station, the bell rings, and the 10 minutes you present the station. When 10 minutes is over, Lolwa, after this, your 2 minutes of the next station reading starts. Got it, my dear? Yep. Clear? Okay, perfect. Thank you. Now, initially, when we were taking the exam, it was 14 in one go. And the college keeps on changing this because it depends upon how the exam is being conducted. However, in the Osler in January 2021, in March 2021, in May 2021, and November 2021, the exams were conducted in a way which was the Osler system, and the Osler system had a break after 7 stations. So this break was 5 minutes, then 7 minutes, and in the upcoming exam of February 2022, it's going to be a 10 minutes break. That is going to be after 7 and next 7 stations. I mean, the break, it varies. It can be there, it cannot be there. But now in Oslo, they're doing a break as well. But then again, every time the students, they get an email and they get the instructions that if they're going to take a little break, 5 to 7 minutes in between the 7 stations. All right. But that is not a fixed format. That varies every time the college does send an email and instructions to the students, right? So you should be prepared for 14 stations in a go. Now, what type of stations they come in exam? The stations are talking to the examiner, the structured discussion in which you and an examiner, 2 people are talking to each other, in which, for example, the clinical knowledge is being discussed, which you people have been doing earlier in your medical schools as well, on your gynecology and obstetrics training exams as well, that the examiner asks the question. For example, it's a structured discussion on polycystic ovarian syndrome. They ask you the Rotterdam criteria. They ask you what are the features which you need to see, what is the ultrasonographic appearance. They ask you what is the management plan. So in this way, you quote the Green Top guideline, the NICE guideline, the TOG article, whatever is the topic. So in structured discussion, it's a medical language and you are talking to the examiner. And how many structured discussions are there in exam? Out of 14 stations, 4 structured discussions are there. Are you guys following me for this? Out of 14 stations, 4 would be only examiner and you, and that is known as a structured discussion. When the station starts, 2 minutes, please. On the beginning of the station, it's written, it is a structured discussion. It is written on the top, it is a simulated patient task. So on the top is the idea of the station, that what type of station it is written on the top. Am I clear, everyone? Are you people following me so far? Yes? Okay. The next stations, which are going to be, would be 6 simulated patient tasks. The 6 simulated patient tasks, thank you, Nisha, thank you, Saman. 6 simulated patient tasks would be the role player stations. So you would be there in the cubicle, a role player would be there who would be your patient, and examiner would be there who would not be talking to you, would just be observing your talk and your role players, that is your patient's talk. Clear? These are known as SPT, simulated patient task. Right, Nisha? Okay, Lolwa? Yes, my dear Anna? These are known as simulated patient task, and we have 6 simulated patient tasks out of 14 stations. Got it, everyone? Please be active in the chat box so that I know that you guys are with me. Thank you. The third type of stations are going to be simulated patient tasks, but with lay examiner. What is the difference? Anusha, the difference is that simulated patient task with lay examiner contains an additional examiner. That means that you are going to be in the cubicle, you will have your patient who would be the role player, and you will have the clinical examiner who is actually an obstetrician and gynecologist who knows the topic, and another examiner who is a layman examiner who is actually targeting towards the scorecard more towards your speech and communication, because it's a non-clinical examiner, not related to the subject, not related to the curriculum. Claire, Sabarnika, Maria. Now, these 4 stations would be simulated patient task with lay examiner. You all should be knowing that in a structured discussion, it's 2 people, you and examiner. In simulated patient task, which are 6 stations, would be 3 people inside, you, your clinical examiner, and the role player. The other one is a simulated patient task with layman examiner. That's going to be 4 people inside, 2 examiners, 1 role player, and 1 you as a candidate. Got it, everyone? These are the 14 type of the stations in exam. 4 structured discussions, 6 simulated patient tasks, and 4 are going to be your simulated patient task with lay examiner. Am I clear? Can we move forward? This is how we used to take exam. The cubicles used to be at the college and we used to circulate. For example, if we are starting from the station number 4, then after reading these 2 minutes, you go inside the cubicle, you perform your 10 minutes. When the bell rings, you go to the station number 5, you start your 2 minutes by reading, and then you go inside, you do your 10 minutes, and then you go to station number 6. At the end, you keep your round complete and you come to the station number 3 because you started from station number 4. All right. So this is how the exam is conducted, and this is how the on-site exam is. Okay. Nowadays, Osler is there, for which in your study groups, I'm going to give you the instructions and tell you that how the Osler works and how is the online exam sitting at your home. How is it different? Because it's all on screen and not practically there, no physical exam. Okay. Now, Pagalu, why? We have to identify because the scorecard is different. And I'm telling you, the first line of the candidate instruction is, this is a structured discussion. This is a simulated patient task. This is a simulated patient task with lay examiner. This is the first line of the candidate instruction. Got it, Pagalu? Why do we need to know it? Because our communication is different. We need to know because the scorecard is different. And I'll tell you just in a bit, my dear. Okay. Now, you people are going to tell me what type of station is this? These are 4 people. What type of station is this? You should be understanding the concept because the scorecard for each is going to be different. Very well done. It's a simulated patient task with a lay examiner. Kuritalen, what is this? Only 2 people inside. What is this? What type of station is this? Yeah, it is a structured discussion. Very well done. Why? Because it's only you and your examiner. What type of station is this? There are 3 people here talking to each other. So it's a role player, a candidate, and an examiner. Clear, everyone? Yes, did you people understand the concept? Now I will tell you it's actually application towards the scorecard. All right, now we have domains to be tested. The scorecard is actually domain-wise. The domains are information gathering, which is what? Which is history taking, basically. The domains you're being tested for are communication with the patient and the relatives, the communication with the colleagues, the applied clinical knowledge, and the patient safety. The domains are going to be tested for the scorecard. That is, you're being assessed for all these domains in 10 minutes station. Now let's get an idea of the scorecard. How is the scorecard being practically designed and how you guys are going to follow the scorecard? Remember, for each station, it is 2. That means it is passing domain. 1, that is, it's a borderline station. Right? And then we have 0. That means it's a failing domain. All of you, please pay attention here because understanding the gist of the scorecard is super important. You're going to understand the gist, then you would target the scorecard. And this is the first thing which I want to teach you today in knowing your exam. For example, if you are having your information gathering, you would see in this information gathering, it is going to be a situation where you are testing everything out there. All questions are done. It would be 2. That is passing information gathering. If in patient safety, you have missed out few points, it would be borderline. And if in communication with the colleague, you have missed out most of the points, it would be failing. And if in applied clinical knowledge, you have done the basic parts, it would be 2. So the points which you cover during the station, this is how the examiner marks you. And the examiner is going to mark you domain-wise. So always see what domain you're being tested for. because the scorecard is like the domain. It is going to be distributed as a domain. Now, 2 for each is going to be passing, like information gathering, communication with the patient, colleagues, applied clinical knowledge, and the patient safety. 1 for each station would be, for each domain would be the borderline, and 0 means that you did not clear that domain at all. When the result comes, if you're passing all the domains and you get a percentage which is passing, the result comes that yes, you satisfied the examiners in all domains. And congratulations, you have passed your Mrcog Part 3, right? Now, unfortunately, if any of the domain is failing, the result comes you could not meet the standards in information gathering or communication with the patient, or for that matter, any domain which is not passing. That means if your communication with the colleague in station number 1, station number 3, station number 6, station number 8 is not passing, eventually that domain gets failed. So passing each domain is essential. You can be borderline in 1 or 2 domains, in 1 or 2 stations, but you can't be borderline or failing on the same domain in all the stations. That means that is your weaker domain. Do you people get that? That how the scorecard is formulated? You have to be, see, one station can have up and down in information gathering, but it's not that in all stations your information gathering is not correct. Yes, if that is the reason, because see, if I'm the examiner for the station number 1, I don't know what station number 2 examiner is marking you as. So eventually, when the scores are getting together, then if your 1 or 2 domains are failing or borderline in all the stations, that means that you need to work on that domain. Yes, no, Maria, it is not essential. Borderline stations can definitely be there. 2 borderline stations out of 14, that can still make you passing. Even 1 failing station can make you passing. But Maria, the borderline domains should not be like common, because if in all 14 stations, 1 or 2 domains are being borderline, then eventually the exam would be failing. You get my point, Maria? Yes. Lolwa, generally, if you are very good in 10 to 12, you tend to pass the exam. Okay, but then again, Lolwa, that does not mean that in all stations your 1 or 2 domains are getting weak. That means that that domain eventually would be getting failing when the result would be compiled. Okay, so it should be a balance. Now, why I was emphasizing on the point that we should know that it's a simulated patient task, or for that matter, it's a structured discussion, or for that matter, it's a layman examiner. See, 4 structured discussions are there, and generally the structured discussions are the lowest marks containing in the scorecard. 3 domains are being tested. Everybody please pay attention here. 3 domains are being tested, right? In these 3 domains for each station, that means 6 score you can maximum get, right? 2 plus 2 plus 2. Generally in the structured discussion, because the patient is not there, so communication in the patient is not the domain to be tested in structured discussion. Why? Because you're talking to your examiner. Okay, so 2 plus 2 plus 2 is equal to 6. How many stations total we have the structured discussion in exam? Everyone, 6 is for 1 score, right? 1 station score is 6. Why? Because 2 is maximum for 1 domain and 3 domains are for 1 station. So how many total structured discussions in exam we have? Please tell me how many total structured discussions we have for the exam. Yes, out of 14 stations, how many are structured discussion? Quickly, quickly, quickly. Yes, we have got 4 structured discussions. Yes, so 6 into 4, that means it is going to be 24 for exam you should be knowing. Got it, everyone? That how it is going to be the situation? Yes? Okay. Now, when we talk about SPT, in SPT, we do have 4 domains to be tested. So 4 domains means that maximum score for each structured discussion, you people are going to get 8 for 1 SPT. Right, Sharika? 8 is the maximum score, 2 plus 2 plus 2 plus 2. 8 is one station maximum score if you score 2 in all the domains for 1 station. So total 6 SPTs are there. That means in your exam, 48 is the score for your 6 simulated patient task. 24 for the structured discussion and 48 for the simulated patient task. Am I clear? Am I clear, everyone? Got it, please, that how simulated patient task total means and what structure discussion total means, please? Yes? Okay. In SPT, Lini, everything is there. Any 4 domains can be there. All the domains are part of the SPT. Any 4 can be tested. So we always see the domain, my dear. Okay, Adslin? All right? Okay. Now, coming to the most important point, that is the lay examiner stations, which are the most important stations for exam. What is the reason for that? Reason for that is that in the lay examiner stations, we have got 2 examiners to score for 1 station, right? 2 examiners, they are scoring for 1 station. So actually what we are worried about in this station is that we should do these 4 stations really good. Reason for that is that SPT, that is the clinical examiner, is going to check us on 2 plus 2 plus 2 plus 2, that is same as the SPT. And the lay examiner has got 3 as well. When I say the lay examiner does have these 3 domains to be tested, other than the applied clinical knowledge, which the lay examiner doesn't have, all the domains are being tested by the lay examiner, which actually mostly is all those which are related to your communication. So in these 4 stations, SPT plus lay examiner, 32 score for SPT and 24 score for your lay examiner. So just 4 stations, they actually contain 56 score for exam. And I always tell to students that if you are passing your lay examiner stations with a very good score, you are passing your exam undoubtedly. Why? Because in this situation, you are actually reaching to the top. Yes, you are reaching to the top. In 4 stations, 2 examiners are actually making your score. So if 1 or 2 structure discussion goes up and down, please don't worry about that. We do have a margin to cover it up. I don't say that we should take structure discussion lightly, but at the end of the day, it should not make your simulated patient task suffering, because you should have a clear idea that you still have a chance to pass the exam, even if 1 or 2 goes wrong, or if 1 or 2 goes a little up and down. Am I clear, everyone? Did you people understand that how important is the structured discussion, how important is simulated patient task, and the most important is the layman examiner station? Yeah, the layman examiner stations, they're important because they are actually being tested for 2. So remember the station with 3 people inside, the role player, the clinical examiner, and the layman examiner. These carry the highest marks. Okay. So this is what you need to remember, that these contains highest scores. So we always work, and generally, please, these types of stations in which there are 2 examiners are difficult in communication. For example, sexual assault would come with this 2 examiners. Domestic violence would come with 2 examiners. Emergency contraception, a young girl with the Fraser or the Glick needs to be checked. It comes with 2 examiners. The vaginismus is a very important exam station. It comes with 2 examiners. So where you are being tested for your empathy, the breaking bad news, oncology, cancer, malignancy, these types of stations, they come with 2 examiners, which are difficult in your communication, difficult to settle the patient. The angry patients, they come as layman examiner stations. Do people get that? That how we can tell in the curriculum, okay, these would be 2 examiner stations. Yes, because the ones in which you have to show your skill in settling the role play. Got it, everyone? So this was the part where I wanted you to be clear at scorecard, because I always say that when you are clear about the scorecard, then you understand that in which direction you need to put more effort in. And this is the smart student. Yeah. Now let's see domains one by one. That what are the domains, what does it contain, and how we have to be confident in each domain. When we talk about the information gathering, it's being tested for. In information gathering, your history, your examination, and your investigation, it's being checked, right? History, examination, investigation, when you cover this in the first 3 minutes, information gathering is being checked. This domain contains information gathering. Now, how do we start? We start the information gathering with the presenting complaint of the patient and then history of presenting illness. For example, it's a heavy menstrual bleed. We would ask about the cycle. We would ask about the details. We would do the signposting, ask about if the bleeding is after the sexual intercourse. We would ask if it's bleeding in between the periods as well. Are you passing clots? Do you feel that you are tired, exhausted? Do you feel fatigued earlier? That means that you're doing quantification of the bleeding. Since when is this happening? Did you take any medication for that? How was the response? So your HOPI would revolve around the bleeding. Then, Walaikum Assalam, Sadia. Thank you very much for joining in, my dear. Thank you, Umma. HOPI, after completing that, you take the gynae history and the obstetric history. Everybody, please pay attention. This sequence you have to follow because an organized, structured information gathering that contains score. If it would be an obstetric case, all those, I'm talking to my 51, 52, 53, all these 3 batches, please pay attention here. When you're having your obstetric case, that is a pregnancy case, you are going to take the obstetric history first. So may I know about the pregnancies? Okay. If it would be a gynae case, then you will take your gynae history first. I mean to say that obstetric and the gynae history, they can be switched over, like one earlier and the other second. Why? Depending upon the case scenario. Am I clear? After HOPI, in obstetric case, obstetric history would be first. In gynae case, gynae history would be first. And the other one would be the second one. Then you ask her that any medical illness for which you see your GP regularly, any family history of concern, and may I just confirm that did you have any operation on your tummy or down below? Any medications you have been taking, any known allergy? Few personal habit questions. Do you smoke, drink alcohol? Pardon me to ask, any recreational drugs? What do you do to live, Anne? And how's the support at home? How had you been feeling recently? This completes your structured information gathering. These are fixed questions. How we deviate from these questions, how we respond to the answer, I will tell you when we will do the detailed questions and the detailed simulated patient tasks. But this is the outline of the information gathering that should be on your tips. And this is the first thing which I tell students, that in all SPTs, the first 3 minutes is always information gathering. So why not to make it easy for ourselves? Yes, why not to make it easy for ourselves? Because this information gathering is going to be the first part. And believe me, whenever the student starts a station, in the first 3 minutes, we come to know it's a passing candidate or a failing candidate. Because your confident information gathering is the first impression on the examiner. Am I able to clarify that how important it is, the information gathering, please? Did you people understand that how important it is, the information gathering? Because your information gathering is not smooth. You're shaking your questions, you're fumbling, you're jumping from one point to the other point, and you're not confident. Your start of the station goes very shaky. And that shows that you're not a well-practiced candidate. And the one who is going to be smooth in information gathering, who is very quick, the questions are coming one after the other without any confusion, is very clear that this candidate has been practicing really well. I want information gathering to be on your spinal reflex. My students, if they are shaking the information gathering, that is actually a failure of mine. That means that you people are not practicing. And this is something which we can do with practice. The questions, you don't have to think. They just come out spontaneously. We all have to practice information gathering to be perfect in the first 3 to 4 minutes of the station to have a very good impression. And believe me, if your first 3 to 4 minutes are smooth in the station, that means that you are going to regain your confidence, and your information giving part, which is the second half of the station, that would definitely be confident. Clear, everyone? Yes, Lenny, my dear. Yes, Oma. Yes, Nisha. Yes, Aparnika. Clear? Thank you, Sadia. Now, the second is the communication with the patient and relatives. This is the second domain. This is a very important domain. Why? Because information gathering is like 3 minutes, but communication with the patient, it starts from your entry into the cubicle, right? From the very start, and it ends on your thanking the patient. I mean, communication with the patient is completely evaluated in the entire 10 minutes of the station. How do we practice this? We should be knowing about confirming the details of the disease to the patient. We should be knowing that how to talk in a patient's terminology. You should be able to inform about the condition. You should be able to know that how do we get engaged in the talk? How do we negotiate? I will tell you the negotiating skills and I will make you master in the negotiating skills. And at the end of the day, it should be a shared decision where your patient should agree with you. This comes with practice. All the terminologies which you have to speak in your station about any condition that has been given by beautiful RCOD patient information leaflet, or any topic which is not being covered by RCOD patient information leaflet, you have got NHS patient information leaflet for the same. Students, they make mistakes in communication with the patient. How? They forget who they are. They forget that they have to behave, or they have to act, or they have to communicate as an ST5. At times, in communication, they're very shaky. Specifically, I see many students feeling awkward and embarrassed, asking about the sexual history. It's part of your question information gathering. You need to take that very confidently, but very sensitively. Examiners want to see that you know the art of taking the sensitive histories. Similarly, communication with the patient goes absolutely failing, no matter how soft you are. But if you're dictating your plan of management, you have to offer your plan of management. And it's patient's choice to select whatever suits the patient's best. Negotiating a plan, but do not dictate the patient. Similarly, if I start the station as a role player and I say, for example, Sharika is doing the station, she's the candidate, and I say that, yes, doctor, I've got heavy periods and they are troubling me for the last 6 months. I've taken everything and it's not working. My concern is that I want to have a baby. And Sharika doesn't respond to my concern. And she says, all right, no problem, Anne. I would like to tell you that the evidence says that you've got a hormone coil and that's the best for the heavy periods. And I'm going to offer you today. So this is not listening to the patient, not respecting the views. Did you people understand? You have to mold yourself according to the patient's desire, according to what patient wants to ask, and according to her concerns. Did you people understand? Listen to the role player and mold yourself according to the role player's requirement. Because yes, NICE guideline says that intrauterine system is the best, but it would not be best for this patient. And could I make myself clear, Vinshu? Yes? Thank you very much for joining in, my dear. Lovely seeing you all here. Thank you. So another important thing which makes your communication with the patient failing is that you bombard the patient with lots of abbreviations and lots of jargons. Yeah? Just in the morning, I was having the mock, and in the mock, the student was saying that this is a condition where the chromosomal abnormalities, these are there, and we are going to check it through the test, and we can do it in the first trimester. So in just one line, lots of jargons were used. You have to be very easy. You have to be understandable to the patient. And this is one mistake which students, they do. Why? Because when you people are practicing with each other, you people are buddies to each other. One becomes a role player, the other becomes the candidate, and you start practicing. You people do not act as a layman or a patient, because you people know these terminologies, right? So always be very strict that please point out your buddy if they are speaking the jargons which you understand because you are from the profession. Please ensure that you people should not understand those points which a normal patient or anybody who is not from the profession should not understand. So always pinpoint your buddy from this. Okay, sorry, doctor, I didn't understand. What do you want to say? So for example, just in the morning, a student said that, yes, I'm going to give you analgesics because you're having pain. I immediately said, sorry, doctor, what analgesics? So immediately you have to correct yourself and say, yeah, we are going to give you pain relief for the pain you're having, if that's okay for you. Got it? Okay. So no jargons, please. And always point out your body when lots of jargons are there, because 1, 2, 3, lots of jargons is spoken, communication with the patient domain goes failing. We do not have to speak jargons. For everything, patient information leaflet beautifully tells us about the words. It's not a uterus, it's a womb. It's not peritoneum, it's lining of the tummy. All right. It is, you name anything, you say that it's not neonatologist, it's a baby doctor. Okay, it's not anesthetist, it's the sleep doctor or the pain relief doctor. Do you people get that? Yes, that how do we talk to the patient? This is how we talk to the patient. The more jargons being used, the more are the chances that your communication with the patient goes failing. So you have to practice with your exam buddy. You have to practice chunking and breaking up information. Please do not speak in one breath. I have to explain to you guys what chunking, breaking up information means. Everybody, please pay attention. Students, they say, my station was ectopic pregnancy, ma'am, and I knew it like anything. It was like ectopic pregnancy, expectant, medical, and surgical management. We all know. So they start the story that the pregnancy is in the tube, and we've got 3 ways to deal with this. One is that we let the nature takes its course. We call it as an expectant management, where we do nothing and let the things they take their own course. Or we have a medical management in which the injection is given, and then we see that the pregnancy is dissolved, or we can repeat the injection again. And the third one is a surgical management, in which either we save the tube, we just remove the pregnancy tissue, we call it as self-injectomy, or if we remove the tube, we call it as self-injectomy and follow the patient up with the pregnancy hormone or the urine pregnancy test accordingly. So these are the 3 options. May I know what suits you best? You gave the entire information because you knew it, but communication with the patient would be failing because you did not practice chunking. You did not practice breaking up information. So I always teach the students that once you come to the information giving part, that is the second half, which is your applied clinical knowledge, please practice chunking. I will do a good way now. Yeah. All right, Anne. So we've got 3 options to deal with this pregnancy in the tube. And the first is the expectant management, second is the medical, and third is the surgical. I will take one by one each, and I'm here to answer all your questions. For the first one, we do nothing and we let the nature takes its course. We call it as an expectant management. And we are going to see with the pregnancy hormone if that's falling. Are you following me for this? Yes. The second one is the medical management, in which we give the injections, and this injection that actually dissolves the pregnancy. Again, on the upcoming days, we repeat the pregnancy hormone to see that if it's falling, or we have to repeat the injection. Are you with me, Anne? Would you like me to tell about the surgical management as well? All right, Anne, in surgical management, it depends upon the blood pressure and the heart rate of the patient. If it's stable, we can do through the keyhole surgery, or else if it's an emergency, we have to open up the tummy and perform the procedure. Are you with me? So during this procedure, we see the state of the tube. If at all the tube can be preserved, we just make a small cut on the tube and remove the pregnancy tissue. And weekly, we do the pregnancy hormones later on. If at all, and we see that the tube cannot be preserved because the future chances of the tubal pregnancy are higher, we remove that portion of the tube, seeing that the other part of the tube, the contralateral tube, that is healthy. Are you following me, Anne? Do you have any questions so far? May I know what are your thoughts about these options and what would you like to choose for you? Did you people understand the difference from the first one and this one? Yes. So this second one was chunking. This second one was breaking up information, right? And the first one, which you were doing in your one breath, because at the back of your mind is like time, and you're not concerned patient is understanding or not, but you want to tell because the information in the first was correct as well, but the way was not correct. So I always tell students to break up the information and after each, check the understanding. Okay, for example, it's PMS, and you know that you've got 4-step ladder for the premenstrual syndrome, right? After each, check the patient's understanding. All right, are you following me? Are you with me? Do you have any questions so far? Okay, so these type of sentences in between, when you fix up, you are breaking up the information. Could I make the communication with the patient and relatives clear? These are the mistakes which students they do. So we are going to practice the negotiating skills. And one more thing, if you see my part 3 notes, I always used to make the terminology dictionary for myself. That is, as I told you, that uterus is womb. So for everything you people are going to write on the left-hand side, the medical terminology, on the right-hand side, write down your dictionary, the layman terminology. Clear, everyone? Am I clear about the communication with the patient, that how you're going to make it better? The third domain after this is the communication with the colleague. Communication with the colleague is the easiest domain to pass. And with a tiny time period, you can pass it. It doesn't take any time. For example, you start the sickle cell disease management information giving. You say that it's a team of doctors taking care of this situation. So they include the consultant, obstetrician, a specialized midwife, the baby doctor, the sleep doctor, the blood doctor, and if at all some other concerned medical specialist is there according to her condition. Just in 2-3 seconds, communication with a colleague goes passing. But if you don't mention the colleagues, then just no matter it was a passing in 2 seconds, it would be straightforward failing communication with a colleague. So this is the easiest domain, but unfortunately, students, they tend to forget mentioning their colleagues. You should be very clear. You are an ST5 in exam. You don't have to take big decisions. If the patient is having postpartum hemorrhage, the consultant has to be there. So don't put yourself into a difficult situation for this. You should be knowing how to communicate with the colleague. That means that the SBAR tool, the situation, the background, the assessment and recommendations, I will clearly teach you how to do the SBAR in communication with the colleague, because that's the basic thing they are testing you for. Okay, so think yourself and perform as an ST5. If you people would do that, believe me, things would be very easy. I was taking a mock day before yesterday, and it was a senior obstetrician of her place, and student of mine, she did everything in the labor ward herself, even dealing with the bladder injury, dealing with the ureteric injury, lots of things together in this station. I know that it's a skill which different students, they are performing at different parts of the world by themselves. And they are the alone person who is dealing with all the emergencies and all the complications. I appreciate and I respect that because they've got the skill. But once you're in exam, you are an ST5. Then you need to call the concerned person. For example, there's a station in the very important exam station of a chronic kidney disease, and it's an Alport syndrome, which was like in the November 21. And the patient is on enalapril. Now, in your clinical practice, everybody please pay attention here. In your clinical practice, the patient who is taking enalapril and comes for the booking visit, you would change her on the labetalol. Sadia Rafiq, you would second that? So Barnika, you will change that to labetalol being the safest, right? Because the patient is pregnant with you and she came with a booking visit to you. Am I right? In exam, you would not do that. Okay? In exam, you people would not do that. Practically, you guys are doing that. But in exam, you're going to refer to the kidney doctor, right? Well done, Sadia. Well done, Nisha. You people are going to refer. If you do that, it's undermining of your colleague and your communication with the colleague would go failing. All right, so always take care of these tiny points in exam, no matter we are doing practically ourselves in different situations, but in exam, it won't happen. Now, the patient safety domain. Patient safety, by the word is clear, that starting from the beginning, You confirm the name and the age of the patient. You document the allergy. You examine in the presence of a chaperone. You call for help whenever it is required and you feel that it's limitation of your experience. Decision making, confidentiality, assessing the mental capacity. All these are patient safety points. Taking an informed consent, respecting the autonomy for Jehovah's Witness, safeguarding, doing the risk management, correct prescription of the medications, correct contraception in gynecology, and the labor ward prioritization according to the patient's safety in terms of patient's urgency. All these are known as the patient safety domain. If you go to the library, you'll get a beautiful folder for all the domains, for all the modules together for the patient safety. And that's a huge hard work. And you people can just note down and start practicing from day one. In my experience, I would like to tell you guys that maximum students, they unfortunately fail in this domain. They tend to fail in the patient safety because they don't understand that speaking this point is actually being patient safe, understanding audits, understanding clinical governance, understanding duty of control. I apologize that the care you received did not match to the expectations. I'm sorry. We are here to take care of the situation from this point onwards. We will initiate an incident report and we will be very open, honest, and transparent about the complication that has occurred. What I mean to say is that you should be knowing that these points are the safety points. If a complication has occurred, we should accept and we should understand that we have to initiate an incident report. That is patient safety. So you all should be knowing about the consent, about the Frasers and the Gillick, knowing about the correct prescriptions, the correct contraception, and dealing with this in a sequential manner, practicing the protocols. For the surgical module, the World Health Organization safety checklist, the safeguarding, the protocols of the audit, all these, they come in the patient safety. So please keep a note of that. You people would see the change once you start practicing. This is the best domain for you guys. Why? I've got students who were passing in 2019 and 18 and they could not take exam because of the COVID or non-availability of seats. So I'm concerned because it's been long that they've done the Green Top guidelines, the NICE and the talks. For you guys, everything is fresh. This is the best thing, which I always say, that take the exam as soon as possible, because the more gap you give, the applied clinical knowledge tends to get weak. Do people agree with that? At the moment, you people know everything. Oh, yes, my dear Saman. No problem, Saman. You are in touch with the studies, and I'm happy you will do that. So earlier you take it, better it is. Because at least you know what guideline says, and you just have to see the way how you have to speak it up. All right. So apply clinical knowledge. You have to be very clear, be in a structured manner. For example, if it's an ectopic pregnancy, I gave you an example. It's not that you say surgical, medical, expectant, right? There's a way. You don't have a scattergun approach to the task. You go in a manner that you understand the situation and you give a complete knowledge which is up to date and evidence-based. It should not be a patchy knowledge for you guys. Also, do not try to cover up the complications, or for that matter, something which for the patient will be upset on this. We don't have to hide this. Be honest. If complications of diabetes, we have to tell. If you would tell about the complications for any pregnancy, for example, asthma in pregnancy or diabetes in pregnancy, or for that matter, any renal disorder in pregnancy, we should be knowing that we are telling what evidence says. We should be knowing that we are following the guideline, but at the same time, we should develop the applied clinical knowledge as per the individualized requirement of the patient as well. If your applied clinical knowledge is good, for example, it's a heavy menstrual bleed, and you send the complete blood count, you send the ferritin as well. Isn't it an unnecessary investigation you are sending? The guideline doesn't recommend that, right? So your applied clinical knowledge goes borderline or failing. You have to send only those investigations. It's not that, often in the clinical practice, you write unnecessary investigations just to satisfy the patient. It would not happen in exam. In exam, you will do only whatever has been suggested or recommended by the guideline, please. Okay, so outside the cubicle, in 2 minutes time, you all have to read the station carefully. From day one, be fast reader. Please don't read in leisure. For example, lying down on the bed, or forever and ever the candidate instruction is in front of you and it's taking so long. Because if you slow down your speed and get the gist of the station in 5-7 minutes, how will you get that in 2 minutes? From day one, read in 2 minutes, please. All right. Reason being that if you're not going to train yourself for 2 minutes today, you will miss the important points in exam day as well. So from today, you people would make your 1 minute for reading and 1 minute for organizing yourself. And your reflexes would be sharp and your reflexes would be strong. Yes, Madhupriya? Yes, Kavita, my dear? Okay. 1 minute for reading and 1 minute for making the outline. All right, I will just tell you, Sadia. We'll take, Sadia, note down the question, my dear. I'll take each question one by one, just in a bit while ending up. Okay, sweetheart? Just note down the question, my dear. Now, inside the cubicle, when you start, make a very confident introduction and set an agenda. This is the starting. Hello, I'm Dr. Sadia, one of the doctors in the antenatal clinic today. May I confirm your name and age? Is it okay I call you Amanda? Amanda, I have gathered from your case notes that you're here today, that you're 6 weeks into your pregnancy and you've got a condition, asthma. Is that right? Surely, in the next few minutes, I'm going to discuss about your condition. To know you better, can I ask you questions and together we can come to a safe and acceptable, a mutually agreeable plan? Thank you very much. Can you tell me more about your condition? Now I will start my information gathering. Did you understand how do we introduce, how do we set an agenda? Yes, agenda setting means that you confirm that what made her come to you. This is an agenda setting. Okay, for structured discussion, introduction is, hello, I'm Dr. Nisha. I'm one of the exam candidates for today. I've read the instructions and I'm ready for the structured discussion. Clear? Am I clear about the introduction of a structured discussion? And am I clear about the introduction of a simulated patient task, everyone? You have to cram it up. Don't make mistakes. If it's written antenatal care clinic, please don't speak the other clinic. Okay, no problem, Sadia Shirazi. No worries, my dear. It would be available to you guys in your study groups, okay? All right, thank you. So after this, please address the concerns and management plan. Management plan should be started around 5.5 minutes. This should be in chunks. And meanwhile, check the patient's understanding. All right, and then summarize. And in the end, give a written information leaflet and close the station. Okay, you said that this is the information leaflet and the support group. And thank you very much for seeing me today. Am I clear that inside the cubicle, how do you divide your station? And you should be knowing in few days, I'm doing the last minute tips for the February people. I'll tell you the last few things. We'll give you the racket as well. You people would understand that I'm already telling that what mistakes in the last day you have to avoid. Okay, Priyanka, you have to write down for me, my dear, what point you want me to repeat, please. Okay, now, how you have to be organized. We have understood that what MRCG Part 3 curriculum is all about. What is the scorecard all about? But how we have to be focused. I did this exam in 1.5 months after my Part 2. And many of my students, they cleared in September. The Part 2 result was in September. And in November, they've passed MRCG Part 3. All of you can do that. It's doable. The only thing is that you should know what you have to speak. There was a time back in 2015 and 16, friends, when in 2 weeks after the result of MRCG Part 2, MRCG 3 was there. At that time, they didn't used to call it MRCG 3. It was MRCG Part 2, Part 1 and MRCG 2, Part 2. Do you people know that? 2 weeks only. Because it is actually applying the same knowledge and speaking it. And generally, the OSCEs are with a very short time gap. So the first thing is that you people understand amassing the curriculum. You people understand that what is the curriculum all about, and you have to organize it module wise. The way, do you people remember that when I gave you guys and Safa was giving you guys all the channels, and module wise everything was actually distributed for you guys? How easy it was, that everything is in the module and you people know doing it together. May that be gynecology, may that be maternal medicine, may that be antenatal care. Being organized in study is the most important thing, and that is the basic flaw which the students they have, and they tend to fail. So from day one, you people would be organized. You have to make separate folders of the curriculum and the right schedule, that this is the time period we have, this is the plan of the exam we are aiming for, and then you have to do at least 3 revisions of the important stations, right? Pagalu, my dear, let's see. I will tell you that what exactly it is. This is my syllabus. You all have it in the channel, the books channel. The syllabus is given. It's an open syllabus of all modules. Out of each module, what topics, Pagalu, they come in exam. Module number 3, and then gynecology problems. Then all, you can take the printout of that. All important stations are there module wise in the syllabus. It's all given, and the related patient information leaflets are also given with this. It's there in my Telegram channel, and you can take the printouts. What I used to do was keeping the syllabus in front. For example, epilepsy is page number 42, get through. I will write it down. Okay, that epilepsy is 42, get through. My syllabus was so organized, everything in front of it, and these pages would make your journey super simple and easy, and time would not be wasted. Ashmi, my dear, in the open channel, it's there. You can ask Madhu, the moderator, as well. Okay, sure, Ashmi. I'm just going to put you in the open Telegram, okay? And she will put in your study groups as well. You can take the printouts, because these are the stations you have to do. And for many, many years, I've been updating them. Even the recent ones have been added. You just have to do. Okay? Yes, Saman, I will give you. Then it is, thank you very much, Madhu, my dear. All right, friends, your favorite Madhu is here. Thank you, my dear. Just post this so that students, they can take the printouts. Thank you very much. All right, then you have a complete booklet of the patient information leaflets. I will post that as well. All the patient information leaflets of the curriculum, they are together at one place. If at all something is not there in my channels, everything is together. Everything is at one place. You just have to search there. You don't even have to go to Google. Everything related to one topic is together. And I'm sure all the paid students, they've already subscribed to the channels, right? Reason being that you don't have to waste your time. Everything is at one place. You just have to search there, read it, and just learn it. Thank you, Sadia, my dear. Thank you, Lenny, my dear. You just have to learn it. It's together at one place. Nothing you have to search out of that. Everything is available at that very place under the heading of that module. All right. This is how the time is saved. And even the recent things, for example, yesterday, if something is there, I keep on updating and I keep on putting there. Reason being that you need to read the updated thing. Okay, so you just follow those module-wise channels, and that's it. You don't have to go anywhere for anything outside that. Okay, now, as we had many single-based answer books and the extended match question books, so here we have the books, which are the Lisa Joel, and we've got the Oxford Task, and we've got the Tony, and we've got Get Through and Justin Punjay. These 5 books are sufficient for OSCE. Important exam stations have to be on your tips, but these 5 books are sufficient for the preparation. Out of that, many of the solved templates beautifully on your website. They're already there. You just have to cram up those templates. Nothing else is required. You cram up that template, stand in front of the mirror, speak up, correct yourself, and get corrected by me and the moderators as well. All right, you will feel the difference. All these stations, they are sufficient in these 5, and the books are already in the channel, and you already have the books in the Telegram as well. Then, after knowing the curriculum, this is first knowing the curriculum, okay? You have done the collection of the curriculum. Now you have to organize the curriculum module-wise so that you don't have a trouble. 14 stations, 14 modules: the teaching, the core surgical skills, the post-operative care, the antenatal care, the maternal medicine, the management of labor, the management of delivery, the postpartum problems, the gynecological problems, the self-fertility, the sexual and reproductive health, the early pregnancy care, the gynecological oncology, the urogynecology, and the pelvic floor problems. One station from each. But let me tell you, at times there's an overlapping as well. For example, in my exam, early pregnancy was there as the molar pregnancy operation theater notes, right? And it was a teaching station overlapping early pregnancy. On the other hand, from teaching, I had bullying as well. So what I mean to say is that it can be a little overlapping of this. Yes, Isha, my dear, one module, one station, but at times, Isha, sweetheart, it can be overlapping as well. Like I'm telling that molar pregnancy came as a teaching. So early pregnancy and teaching both were covered. And then bullying was there also in teaching. So early pregnancy care, molar pregnancy operation theater notes were there. And I had to teach my junior to correct those notes and to give the feedback on that operation theater notes. You get my point? But generally, they touch each module, at least one station each module. So why am I telling you this? Because if you do one module, it would give you one satisfaction of this. Okay, my one station out of 14 is done. This is being organized. For example, if you open up my syllabus and you do all the teaching stations, so you say, okay, my teaching is done. Got it, everyone? This is what I made for you guys, that this is the folders, and I'll show you a practical picture of my student who passed in September, the MRCT Part 2, and in November, MRCT Part 3, and is part of RFA as well. This is his picture. And he messaged me, ma'am, on day 1 of introduction, see, I've made my preparation. I've taken this from my WhatsApp. Just to encourage you guys that I want you guys to be organized in your preparation. Did you people see? After the session, he organized himself and made all the arrangements that now I would do an organized study, and 1.5 to 2 months, I would just pass it. I have put these pictures specifically to encourage to you guys that this is possible. Students like you, they do it. They have been doing it, right? Yes, correct, Madhu. Yes, my dear. Then making the right schedule, the right time. And you should be knowing exactly that this is what you have to do. And then no ambiguity about the revision and the important stations. You all should be very clear that it has to be at least 3 revisions and all the important exam stations. That's my responsibility. You are going to have everything on your tips. And the last thing which my February students are doing nowadays, and all my RFA moderators and the co-mentors, they would be agreeing to this, that 14 station in a day, that really helps you to get exhausted, and stamina building, preparation aiming to build focused approach. And you have to test your limits for smooth exam circuit. Yeah, Sharika, you know it, yes? And revise the templates. You all have to do that in one go. Now, the question is that how much time is enough? For this, Safa had been talking to me in detail for all the concerns you people had been sharing with Safa. So see, it depends upon what exactly is your situation. There are few students who are messaging me that, ma'am, after the result, we are going to appear in May because we just want to do it in 2.5 months. Absolutely okay. The ones who are having some commitment, or the ones who are actually having a language barrier, it's absolutely okay. You take the November. So both the courses would be there. The 3 months for May, you already, many of you have joined. The others who can join in the result day, that's not a problem. And the other would be 6 months. That would be starting now as well. Why? So that you can have long-term preparation till the November exam. Okay, so whatever is actually your suitability in terms of your hospital routine, in terms of your background, because part 3 actually depends from where you're taking a start. If you don't have a language problem, then 2 months are absolutely enough for preparation. But if at times there is a language barrier and you need to learn and get into the flow, then 4 or 5 months they are required. So let's get started with all this preparation.
Hi, everyone.
I would just like to encourage all of you that people had been doing just like you. After November would be 2023. So people had been doing just like you, and they just passed in one go. I would like you all to take a start in this, and this is just for your encouragement. That how did
Hi
they do
everyone.
that?
My name is Jagdish. I'm from Malaysia and I currently work in Kuala Lumpur. I first met Dr. Sidra when I was preparing for my Part 2 Mrcog exam, and she was instrumental in helping me pass in just a single attempt. So naturally, when I was preparing for my Part 3 exam, I went looking for her. I took 2 courses with Sidra ma'am. The first was a 6 months course that started mid of last year. It was supposed to end just before the November exam, but as we all know, that exam never happened because of COVID. But still, that course was completely wonderful and completely comprehensive. We went according to module base, and it was perfect to help me start preparing for the exam and building my confidence. Dr. Sidra taught us everything from what to read to how to do our notes and how to even practice in our mini groups. And most importantly, she taught us what the exam really wanted from us. So when we were finished, she still never lost touch. She still guided us through, and she was holding our hands till the very end. So when I finally got a place in November this year for the exams, I took a fast course track with Dr. Sidra. The RFA has got a brilliant website, and they have all, I mean literally all the summaries of the Green Top guidelines, the NICE guidelines, and all the TOG articles that was important. And this made revision very, very simple. They will also solve templates from all the books questions, which was fantastic before revision for the exam. So preparing for an exam like this, I think, especially since it was a UK exam, can be a little tough, especially if you're going to try to do it on your own. And that's where I think Dr. Sidra and her team was instrumental. She made it seem so easy. Dr. Sidra also shares tips on how to book a place for the exam and how to get a seat, which I think is something a little extra. I never have met anyone so dedicated to her students like how Dr. Sidra is, and she and her team is really invested in our success. So I honestly don't know if I would have passed without Dr. Sidra and her team. My advice is for everyone listening is that if you have a job, a family, and you don't really have dedicated time to prepare for this exam, or you just simply don't know where to start, get in touch with Dr. Sidra and her team today. All the best.
Thank you very much, Jagdish. Miss you all so much. You were a wonderful batch. And I still remember chatting together and fighting together in the mini group that how we have to do this role play. That was lovely. This was Jagdish from Malaysia, friends. An awesome batch and just clearing in first go. Very well done. And this is just an encouragement for you guys that you people can do in one go as well. Now, coming to the course, please, the 51, 52, 53, all the batches, they're already ready and they're packed up. So module-wise sessions would be there, depending upon the timings. The timings for a few of the batches I've announced. Others would be according to what you people would decide because it's a smaller batch. So the teaching, urogyne, gynae, staff fertility, oncology, the sexual and reproductive health, early pregnancy, antenatal care, maternal medicine, surgical and post-op labor and delivery, postpartum, everything would go side by side. Another important thing that you all need to remember is in this situation that for this case, two types of batches would be there. If you want the November preparation, then it would be a long-term batch, 6 months batch, right? And you're going to tell to the moderator while booking that, okay, we want the 6 months batch, and the other would be the May batch. So whatever would be your feasibility, according to that, you can book, right? So you all have the links in your study group, and the older students, they've got their coupon as well. Now the mics are open, and there were a few questions. Sadia, Sharika, I'm happy to take the questions one by one. Anything about the preparation, anything about the curriculum, anything about you people wanted to ask about the domains. Now you people can unmute also, and you people can type also. I'm here to take the question. Sadia, you wanted to ask some question, please. Now tell me. Yes, my dear, you can copy paste the question again. Yes, my dear. Yeah.
Hi, ma'am. I wanted to ask you,
Yes,
when we are giving the patient information about the treatment options, etc. So we are just giving an overview. We're not going into much detail.
Okay.
So what about if she asks something in between?
We are not going into the overview. First, we give the outline, my dear. Then she says, for example, it's an overactive bladder. And you said that we've got certain medications to start, lifestyle modification, you've already told. She says, okay, ready, I'm ready for the medication. So then you have to tell about the anticholinergics. So you always should be ready with your 4 or 5 lines, because out of that overview, patient can tell you, I am happy to go with this.
Okay, ma'am.
All right. So then you are going to explain that. And whenever you do one topic, you should be knowing two ways. One is that you just give an outline and she says, I'm going to think about this, doctor, and come back to you. And the second way is that there and then she just says that it is going to be the situation. You would say that, okay, you're happy to go with this type of the management. I'll tell you the details. So then you should be ready with 3-4 lines of this. So 4 to 5 lines of explanation of each part of the management plan, that should be ready for you. Okay?
Okay,
right?
Ma'am, I have another.
Yes, my dear.
Yes, ma'am. Thank
Yes,
you.
my dear.
I have another question related to website. Like I want to appear in November, but I have subscribed for I think May. I didn't know about this 6-month subscription, ma'am.
Okay, it's okay.
So,
I will do the shifting. If you people are not ready for the May, then we can do the shift over. Okay, I'll shift over before starting the course. The moderators will do the shift over. Okay, no worries. All right.
yes, ma'am. Thank you so much.
Okay, thank you very much.
Thank
Saman,
you,
for you,
ma'am.
my homework is that from today, start reading from the website 1 to 2 updated guidelines, my dear, daily. And you have to message me that today I've done this. Okay, because when more gap is there, my dear, definitely we need to get the more applied clinical knowledge, my dear. Okay, daily 2 guidelines revision is must for you. Okay, all right. So Farheen has a question. Okay, Farheen. I'll think about this, my dear. Actually, you know why? Because Farheen, the problem is that maternal medicine and antenatal care, they're together and they're big modules. When you do it in the middle, the leftovers are so much, you people get stressed out. So I always keep it in the end. But no worries, if you people have it in the, you people want to prepone it, we can definitely do it. It's all flexible, no worries at all. Okay. We should always summarize, Kavita. Yes, once you will start the stations with me, with every passing station, you people would become master. Okay. All right. There was another question. Yes, definitely. Yes, Sadia. Next is going to be your testimonial. Yes, my dear. Any other question, please? All right. Are you people clear about the curriculum? Yes, please. Yeah.
Ma'am, it's Dr. Priyanka here. Actually,
Hello,
when I didn't know
Priyanka.
about the 6 months thing, ma'am, can I just take the exam in November, ma'am? Because
you're Priyanka
old.
Santosh?
Yeah, yes, ma'am. Yes.
Okay, my dear Priyanka. All right, my dear Priyanka. I will.
Too long.
Okay, no worries at all, my dear. I will tell the moderators to shift over and then check you guys. Okay, no worries at all, my dear. If you people are clear that you people are not doing the May exam, few students, they are shaky, they will take the earlier one. So if you people are clear that you are not going to apply for the May one, it's absolutely okay. I'll put you in the other batch. Okay. Yes, my dear. Ashmi, my dear, just log into the site. You'll get all the templates there. Okay. Or you can just message Gia. She would guide you. Okay. The coordinator. All right. Lolwa, if you want to do it after November in 20, how many months needed for the preparation? 2023, Lolwa. Why, my dear, so late, Lolwa? Arika, my dear, it's only on the website and you're going to read it online. Yes. Okay, SPT, no interaction with the examiner and also with the layman examiner. Yes, Reena, you don't have to look to the examiner at all. Why? Because examiner is just doing the marking for him or herself. You are only going to contact and communicate and talk to the role plan. Yes, Sharika, my dear, more than happy for you to unmute. Yes, my dear, please. Hello. Yes, Sharika, my dear. Everybody can unmute. Yes.
Can you hear me, ma'am? This is Zuna here.
Hi, Zuna. Yes, my dear.
Yeah, ma'am, I just want to ask that what about us? Like, still the result not yet. So can we?
Suna, your friend has joined the Mrcog actually yesterday. She's doing the book.
Yeah,
Okay. Suna, after the result, many of the students they've contacted and Safa is going to just distribute you guys in batches as per your study buddies and as per your arrangements. Okay. All right.
So we should wait
hoping. Hoping for the best, my dear. Yes, my dear.
Hi,
thank you so much. Hello, my dear.
Hi. Poonam here.
Hello, Poonam. Yes,
I'm in this batch which is starting from 20th Feb.
I know.
So
yes, my dear.
I'm just worried that will we be able to finish the syllabus and revise it before May?
Definitely, yes. See, as soon as the February batch is over, then you people are going to be on throttle, day and night studying, Poonam. It's only that
So-
since February exam is like 21st, 22nd, 23rd, 24th. So these days are tough days. After that, it's going to be only you guys backed up with studies, and everybody is going to be like, encouraging you guys only. So don't worry at all. Okay.
Thank you. Thank you.
Thank you. Yes. Ashmi, for little ones, no, but I'll be making one and let you know. Okay. For the fast track, because it
So,
was a big
ma'am,
batch, then we had it.
hello, ma'am.
Yes,
How are
ma'am.
you?
Hello. I'm fine. Thank you very much. How about you?
Ma'am, I wanted to ask.
Yes, Sharika. Yes, Sharika, sweetheart. Overseas definitely would not clear in. No, Ajay. Why won't you not clear in one go, Ajay? All the overseas they're clearing in one go, my dear. There's no point of thinking for the second time, Ajay. It has to be first go, okay? Yes,
Dr.
yes, Sharika,
Sidra?
my dear. Yes, Sharika.
So Pasadena, as per Dr. Tahira, we can give.
Ma'am, I just.
Yes, Sharika, I can hear you, my dear. Sharika, speak up. Sharika, my dear. Sharika, I can listen to you, girl. Okay, somebody else was asking a question. Yes, Ashmi, please unmute yourself. Sharika, yes, unmute yourself.
Hello.
Yes, Ashmi. Yes, Ashmi.
Yeah, ma'am, I wanted to know that, like, I'm slightly confused. Like, has some classes already started?
No, nothing. It's the first introduction, Ashmi. And just tag Madhu in your study crew, the previous chats and all the channels. She's going to tell you because before you, a few of the channels were posted.
Ma'am,
Yes, Sharika, my dear. Sharika, yes. You speak up, ma'am, and then you vanish.
hi, ma'am.
Yes,
How are you?
please.
Ma'am, I just wanted to know. So, if suppose 22nd we get the result.
Mm-hmm.
I think connection problem.
Yeah, I think Sharika is not having a friendly connection today. Your Wi-Fi is not letting you speak, Sharika, my girl. Do we wish the examiner or the team before beginning
Ma'am,
any
can you hear
station?
me?
Yes, Sharika, speak up, sweetheart.
Hello?
Yes, my dear. Yeah, I can very well hear you. Yes,
Hello.
Sharika.
Hello.
Okay, Sharina, Sharika, I can hear you, my
Ma'am,
dearest.
I wanted to know that if we I wanted to know if we clear, like, I'm speaking, can you?
I can hear you. Please go ahead. Yes.
I think he should write.
Yeah. Sharika, please write down. I think write down your question. Your voice is not audible, then you just vanish afterwards. Yes, Reena. Yes, my dear.
Dr. Sidra, the Osler is the first time. I'm very confused how we
No, Osler
go
is not the
through it.
first time. 4 exams are done for Osler, Reena.
No, for me, for us is the first time. I want to. Do you have any video to see?
Yeah. They've got all the connections, all the details,
Ma'am,
everything out there.
I wanted to know if suppose
Sharika, my dear.
speaking, but okay, I wanted to know that if suppose we clear on 22nd and then this batch is starting from 20th, right? This batch is
This batch is closed, Sharika, sweetheart. This batch is closed. New will be opening up for you guys, okay? Okay. All right. Yeah, that's closed.
And Dr. Sidra, if we
Yes,
are
Reena.
unable to get the seat for the bay,
Don't worry, my dear. Yeah.
so we can continue. We can continue.
You can continue, then I'll talk to you about the access. Yeah. In that situation, you can continue the course so that at least your practice would be like, faster. Okay. So then I'll talk to you about this. Okay. Thank you very much.
Okay.
Isha has a question here, friends. Do we have to wish examiners as well? Isha, unmute yourself. What type of greeting do you want to ask? Tell me. Yes, my dear Subarnika. Yes, immediately on the result day. Yes, Isha, please unmute yourself. Yes, my dearest.
Ma'am, like when we enter a station, we do have to look at the examiners and wish them, or we can just directly go
Structure
and
discussion,
talk to
right? Structure discussion?
No, the SPT and the one with the
No. Do not talk to the examiner at all. You enter into the cubicle, you say, hi, I'm Dr. Isha. I'm one of the doctors in the contraception clinic today. May I confirm your name and age? Is it okay I call you Anne? So you just talk to the role player, my dear. That's it. You don't have to talk throughout 10 minutes. No talking with the examiner. No.
And Dr. Sidra,
Okay, ma'am.
if there is any confusion, who is the role player or is the examiner?
There would not be any confusion. You would say, hi, I'm Reena. I'm one of the doctors in the contraception clinic today. You'll get a response, hello.
No. How we identify which is the examiner and
No,
which is
you are
The one who
online.
responds back
You
is
are
the role player.
online. Exactly. You are online. You say, hello, I'm Dr. Reena. I'm one of the doctors in the contraception clinic today. You get a response, hi, doctor.
So they will not show us the
No,
the video.
all three of them would not be talking to you. The role player is a role player, and generally the examiners, they've got a pen and they've got some writing material as well. So you understand very clearly.
We can able to see the all examiner.
Yeah,
and role player
definitely,
in the
yes,
video.
definitely, yes. The role player has got their own section. When I'll send you the Ostler thing, the role player has got own block. You know that this is the role player would be visible at this place in Oslo.
So he will the answer. Yes. Okay.
Yes. They would say, hi, doctor. So you say that I've gathered from your case notes that you're here today because you want to have an emergency contraception. Is that right? She would start the story. Yes, doctor. I'm here today because I want to have the emergency contraception. So the person who's talking to you is the role player. Okay. All right.
Okay. Also, in the very sensitive communications, they can see how we deal with the patients.
Yes, they do, my dear. There are some
Feeling.
technical problems that do happen, but definitely we are going to coach you for that. Don't worry. Okay. All right.
Fine.
Okay. Thank you very
Dr.
much.
Sidra, hello.
Yes, my dear. Yes, my dearest.
What do you mean by Osler? And is it online, the exam?
Yeah.
it has to be
Osler is a format on which the online exam is happening, in which the candidate, the role player, the examiner, they all are together, and on the screen is the candidate instruction. I mean, it's an online exam from home. Complete 2021 because of the COVID. 4 exams were on Osler, and this is going to be 5th exam now of February on Osler. Okay.
So it will be from my house. I don't have
your
to go
house.
to
Yes. From home. Osler is from home, my dear.
Okay. So this is all the part 3 exam, right?
All part 3 exam, even the UK students, they are from home. Nobody is traveling to the center so far till the last exam, until the February exam. After that, if the COVID situation improves, that would be another thing, my dear. But so far, everything is online. Okay.
Okay. Thank you so much.
Thank you very much, Lalwa. Thank you. Yes, my dear. Reena, your mic is on mute. Done?
Okay. Done. Sorry.
Okay. Thank you very much. Thank you. Any other question, please? Everybody? I hope you people are clear. You people had been requesting for the introduction for so long. And I'm sure now you people understand all the gist and the basis of the MRCG part 3, right? Correct? Yes? Okay, Inta, so good. Yes, Adya. Yes, my dear. Few of the students they're taking at the business centers, few of the students they're taking at the hospitals where the Wi-Fi is good. So once the exam booking is done, then definitely, and they send you a test email for check of the system. The system check is done prior to the exam. So you can do that. Lots of prayers, Aisha. Ask me, my dear. It's equally tense a situation. Of course, I can understand that how important it is for you guys for this exam, my dear. All right. Yes,
sorry,
my
Dr.
dear.
Sidra.
Yes, my dear.
Still, I have the confusion. How can I start the study? How can I make a format? I am listening many videos about you, orientation and everything, but still I am very confused. How can I start to make a format and case?
Okay, you have to write down the lines which I'm speaking now. Hello, I'm Dr. Reena. I'm one of the doctors in the antenatal clinic today. May I confirm your name and age? Is it okay I call you Amanda? Now, if you're not in antenatal clinic, you will just change it from that clinic word. The same introduction would stay. The second line would be, I have gathered from your case notes that you're here today because you're pregnant and you have some concerns regarding pregnancy. Is that right? Surely in the next few minutes, I'm going to talk about your concerns and the details. Can I ask you questions to know more about you? And together we can formulate a mutually agreeable plan. Would that be okay for you? Can you tell me more about your concern? Claire, these are the startings. Yes. You just change according to the station. And if it's a structured discussion, you say, Hello, I'm Dr. Reena, one of the exam candidates for today. I have read the instructions and I'm ready for the structured discussion. And then the questions, they come from the examiner. Clear?
Okay.
And in the end, you
Okay,
say,
Dr.
thank you for your time.
Okay.
Okay?
Dr. Thank
All
thank
right,
you.
just write
Thank
it
you.
down, my dear. These introductions, these voice notes, we're going to do in the groups as well. You people have to write it down, your introduction, your information gathering, your ending. That should be perfect from day one, that you should be ready for this. All right. Okay. Thank you
so much.
very
Thank you.
much. Thank you. I hope you people are clear about this. Thank you very much, my dear Uma. I'm glad that I am of some help to you guys and you people are a family. Thank you very much. So the take-home message is that hard work and self-belief will always earn you success, and study daily and do not stop until you succeed. I would like to say to all of you that don't be reluctant to take the first step. Undoubtedly, it is the hardest, but once initiative is taken, with every passing moment, you're brighter, you're stronger, and you are learned than before. So this day should be a changeover in your attire and your approach as well. So targeting the aim and being successful, we will cherish these moments together. Thank you very much. Best of luck from the entire team of RFA tutors. See you guys in the study group. Yes, Shweta, it is going to be, the recording would be there. Yes, my dear, please.
Today it was discussion in the group. They are asking, there is the time limit of the passing the part 2 from the part 1.
No, my dear. So far, there's no. So far, it's no. So far, it's no time limit reason for the COVID, because the students are not getting seat. Okay, that's the reason. All right. Yes, my dear. What to put in, Ashmi, whatever is in the channels. Madhu is going to tag you there. When you prepare one station, when you prepare that station, you put it in the folder. For example, your sickle cell disease is prepared, your diabetes is prepared. So you put those templates in the folder in the maternal medicine. Got it, Ashmi? Okay, the stations you prepared. Thank you very much for the thumbs up. All right, friends, best of luck from the entire team of RFA tutors. Thank you very much for being here. Thank you, my dear. Love you all. Take very good care. So see you guys in the study group. Bye-bye from my side. Thank you. Bye-bye.